And it's recording. So thanks for coming out.
Yeah, I live in West Chase.
Cure Leaf 101 seminar on medical cannabis. I'm kind of going to talk a little bit about who I am and then kind of go into the cannabis. I run the Dr.Cannabis clinic. We have two locations, one in at the east end of Lutz on edge of Boise Chapel by the Grove, as well as one about 2 miles south of here in the plaza at Van Dyke Commons, where the LA Fitness is and stuff like that. So cannabis has a long history. People used it. The furthest back we can go is 27 BC, where the Chinese were using it. But they know for years that cannabis is helpful and has been used. What's important about the cannabis are the cannabinoids, and what are those? Those are the parts of the cannabis plant that are very helpful to people's health. So when we talk about cannabinoids, we talk about THC and CBD, and that's the stuff that comes from the flowers and is used to treat pain, anxiety, and nausea and inflammation throughout the body. And what kind of roles do they do? They help with eat and sleep, and then physical and mental health. They help with immune systems to make your body stronger to fight disease, cancer growth. And what you're going to see is that we have an endocannabinoid system in the body on all different organs. And so when the cannabis, the CBDs from cannabis as well as the THC products, they'll bind to these receptors and actually help the body maintain its balance. And all different animals have an endocannabinoid system, whether you're a mammal or fish.
So this is your first time at a Cure Leaf?
It affects different parts of the brain. The amygdala is kind of an area especially where there's anxiety and emotion and fear. I'll show you a slide here. When we talk about the cannabinoid receptors, there's CB1 and CB2. CB1 is based on pain, anxiety. That's the big one. CB2 receptors only found on our immune systems. So they kind of help boost the immune system.
I was told two different things, two different times.
CB1 is mostly brain and neurons, spinal cord, that kind of stuff. So when you look at sites of action, where the receptors are, the brain, kidneys, liver, heart, pretty much all over the body. And then the CB2 is basically any organ that stores memory cells, T cells, B cells, which is the spleen, tonsils are big, as well as the GI tract too. So sites, again, for CB1 are located in the nervous system of the body as well as these other areas. So when you look at something like Crohn's disease, that's why it works so well on the GI tract for that. Some of the skin conditions. And then when you look for the CB2 in the immune system, it just pretty much works in all the organs that store immune cells. So these are all the things that cannabinoids can help do. Analgesic, antiemetic, anti-cancer, antioxidant. In the eye, it reduces pressure, so it's anti-glaucoma. It helps decrease GI secretions, which help people with ulcerative colitis and Crohn's, as well as ulcers. It decreases acid in the stomach. And of course, patients with insomnia for sleep induction. And this is just a medical slide, just basically showing the two nerves talking to each other and the chemicals that go across, and basically the cannabinoids binding to the receptor on the nerve of the endocannabinoid system that we normally have in our body, and stimulating, anti-inflammation, anti-pain relief. And again, with the CB2 receptors, this is a study back in 2011. And simian monkeys had what they called simian immunodeficiency, which is sort of the monkey version of HIV. And when they gave them some of these products, what ended up happening is that they saw that the virus didn't mutate as much, and there was less inflammation, and they lived longer. So it kind of helped the immune system. And that's why it's approved for HIV in humans, because of some of these studies. So when you look at the cannabinoids and what their ratios are, so when you talk about marijuana, the large dose of THC, and then the rest are other cannabinoids. And then there's CBD-rich cannabis, which could have different ratios depending on how it is. And then hemp, which is what you see online, where people buying these they're more nutritional supplements, the CBD oils and stuff like that. So let's talk about metabolism, because that's important. So when you inhale the cannabis, you usually get the max effect within an hour, and the active metabolites will last about 2 to 3 hours. After that, it starts getting eliminated. And I'm going to show you a slide on that here. So when you look here and see, this dashed peak is the inhaled THC. So you get a rapid response, rapid effect, and then it drops down at about the 1.5 to 2 hour mark. And so we go back to the slide here, and you look at the ingested cannabis. It takes a little bit longer to work. However, it'll last for 5 to 10 hours. Okay. So when you look at the graph of that effect, yeah, it takes almost an hour to kick in, but boy, when it kicks in, it'll last for hours. And this is kind of where I come up with treatment plans for patients. I always put them on oral solution, because what ends up happening, if you just give them a pen, they'll chew through the pen so fast. The dispensaries may like that, but they're constantly going up and down, where if you have an oral solution that you're taking twice a day and you kind of vape on top of it, you avoid the rocky road of going up and down and up and down, up and down. And the same thing with CBD. So this is the Florida definition of what is medical
How do you find a
marijuana.
good balance, though?
Huh?
How do you start finding that good balance? Is it all just trial and error?
I have people, I start them off on day one with diary page 1 of what we want you to use, and then they're keeping a record every day, titrating their medications. A lot of the oral solutions come with a syringe, so you put a little science back into it. They're increasing slowly, and then writing down how they feel, so they figure out what kind of effect they want out of the medication and their lifestyle and everything else, and what works best for them. Time of day, mostly sativa during the day, indica at night, but that's what they're doing.
Do you recommend starting at night?
No, I just tell them, when you get it, go get it. And if they're nervous about it, start on the weekend.
Right.
You
So that
know,
way you don't have the spiking going on, it's more even kill all the way through?
exactly. The vape works, it'll work within 15 minutes, but you're only gonna last 1 or 2 hours.
Well, that's like my problem. The problem is I don't find any CBDs that work or that are beneficial.
CBDs kind of work behind the scenes. The cannabis CBDs, not the hemp
Yeah,
CBD.
well, that's what I'm hoping, like, that's what I was.
It'll help behind the scenes. What it is, kind of like a Motrin. It's kind of like an anti-inflammatory. You take it, you feel better because you don't have pain, but it constantly cools down. So some people are like arthritis, psoriatic arthritis, rheumatoid arthritis, that are using CBD. Plus, if you have anxiety, it helps enhance your mood too with that.
Yeah.
So you have to have CBD because it helps the body work with the THC products, and it'll help you absorb, the benefits of the medicine using it together. So it's important to have it, even if you just take 10 milligrams twice a day.
Yeah. No,
That's very good. So this is Florida's definition, and Florida defines medical marijuana, basically anything that looks like the plant, touches the plant, is part of the plant. It's considered medical marijuana, okay? And medical use of medical marijuana does not include the following, and this is all the stuff that it doesn't include. Possession, and this is of course based on the old law with the smoking, using it in public, using it in public transportation, and any commercially produced food items other than edibles or marijuana seeds. Again, then using it against the doctor's recommendation. You can't transfer to give it to your friend or your mom or your brother. It's a controlled substance. You're not supposed to be using it in public places, or and employers too, unless they allow it. You're not allowed to have it on school grounds, on a school bus, that Dr. Seuss, not in the, there's a lot of restrictions on it, but, so in Florida, what they call qualifying conditions, it's not opened up for everyone to use marijuana. You have to have these conditions. Okay, so one, you have to be a resident of Florida. If you're not a resident of Florida, then you have to be a seasonal resident, which means you have to be in Florida for at least 31 consecutive days each year, maintain a temporary residence in Florida, and then of course return to the state at least once a year and be registered to vote and pay income tax. The medical conditions are cancer, seizures, glaucoma, HIV or AIDS, PTSD, ALS, Crohn's disease, Parkinson's disease, and multiple sclerosis. So I'm kind of just going to go through some of those. And then there's similar conditions. So like, for example, I have patients that have ulcerative colitis. It's not Crohn's, but it's very similar to ulcerative colitis. So they'll qualify. I have a lot of patients that have anxiety. You know, it's not PTSD, but it's very similar to PTSD. So therefore, I'm allowed to write for them. I have to fill out paperwork to do it, but that enables me to get them the medications. Then there's chronic non-malignant pain, but the conditions you have to be relatable to something on the list. You can't just have chronic pain from something that's not on the list that we just talked about. So let's talk about MS first. MS is a debilitating and sometimes fatal disorder from the central nervous system. And basically the nerves in their body aren't working. There's compromise at the brain level as well as the spinal cord. The myelin is a chemical that covers the nerves. It's basically like an outer coating, like of a wire. And what happens when it gets damaged, the impulses don't travel well through the wire, so they'll often get spasticity and weakness. And a lot of the products, especially the CBD, which I use with MS patients, kind of cools down this nerve inflammation. It doesn't stop the disease, but it kind of slows down the progression of it, so the nerves aren't destroyed. And it all depends on where you have it. I mean, you could have weakness in an eyelid, and that could be your first signs that you have MS. You could have weakness in a hand or a finger or a foot, and that's how they'll first diagnose you with MS. It all depends on where it is when you have it. So how does medical cannabis help MS? The biggest thing is the anti-inflammatory. It cools down the nerves, so you don't have the destruction of the myelin sheaths, and that way the nerves will work and conduct impulses. A lot of the issues I see with the MS patients are spasms and weakness. Pain relief also with some THC products help MS patients. A lot of them get restless leg syndrome, bad spasms in muscles, so they can't sleep, especially at night. It also is an antidepressant because it's not a disease you want. A lot of people, along with the disease, they get depressed over it. So the medication helps them, especially with sleep. PTSD, post-traumatic stress disorder, it's something that occurs from a traumatic stress in your life, and you end up with anxiety and stress over it. And so the sativa is very helpful with PTSD, as well as the CBD. And so I usually start patients out with that, and they kind of titrate it up until they get the benefits of it. The pens are very helpful, the vape pens, to treat with anxiety. When the studies that were done with PTSD, it showed that patients that used it had a 70% reduction in the symptoms compared to patients that weren't using cannabis. So it's very helpful for anti-anxiety. It helps with insomnia. It helps with their sleep cycle and reduces their REM sleep so they can rest. And that's why it's been approved. We have a lot of veterans in our clinic, so I treat a lot of PTSD there. Indica works very well. I have them take a dose like an hour before they go to bed, on a cookie, something fattening, kind of get the indica up in their bloodstream, and then they just vape right before they go to bed, and it helps them sleep throughout the night. Parkinson's disease, again, it's another nervous system disorder. Again, proven with science that it does help. I have one gentleman, he's like 76 years old, and he lives alone over here. His daughter's in Miami, so once a week she would drive up, take him shopping, put him back in the house. After a couple of months, he started driving again. So he doesn't see his daughter as much anymore, but he's driving. His tremors are under control so much with CBD and sativa that he's able to drive. And it's a progressive disease, so it doesn't a cure, but it helps enhance dopamine secretions. And dopamine is that chemical that Parkinson's people lack, which helps the brain stimulate muscle contraction and control. This is just all Parkinson's disease stuff, medical stuff. About 60,000 patients are diagnosed annually with Parkinson's disease. And so how do they help? Cannabinoids help alleviate some symptoms, again, at those receptors where they increase dopamine secretion and cool down the nerves there. Cancer is another big one that we use medical cannabis for. So what is cancer? Cancer is basically cells that just don't know better, but they just grow. They grow on their own. They kind of go off the train, off the track. They grow and they secrete chemicals in your body that normally your body regulates, but it just secretes them at such high levels and interferes with sodium, sugar, fluid retention. And depending on where the cancer is, it'll push on organs and spinal cords, lung tissue, and block blood flow. A lot of the symptoms you see with cancer patients, fever, fatigue, weight loss, pain, skin changes are very common. Changes in bowel or bladder habits. Unfortunately, today the treatments we have are surgery, radiation, and chemotherapy. And with those treatments, you're not only killing healthy cells, but you're killing the cancer, but it takes a toll on people.
Okay.
Especially cells that replicate a lot. So your red blood cells, your white blood cells, all your lining of the GI tract where those cells are made up every 30, 40 days, they're damaged by all this radiation. It's kind of a shotgun approach to where a surgical knife needs to be. The good thing about it is some of the recent studies with cannabis, especially CBD, is they've shown that it turns off cancer cells. It doesn't cure cancer, but it stops the metastasis and it stops it from growing so that it can remain sizable to where you can use radiation or you can surgically remove it. Besides that, it's also helpful for the effects of nausea and vomiting that you get with chemotherapy, and also helps with pain. And that's what the endocannabinoids do. They try to maintain and restore balance in the body. And this is what I was talking about in medical terms. Basically, it turns off the growth. And this is from a recent study that I believe came out 2-3 years ago from the National Institute of Cancer. So HIV and marijuana, the biggest thing again is the anti-inflammatory effects. It stops the viruses from spreading, which is a big part of HIV. The virus just gets into healthy T cells and keeps on replicating, and it just drops people's immune system down to nothing. So it makes them susceptible for pneumonia infections. With HIV, it stops the progression of the disease with the virus, and then also helps with the nausea, the vomiting, the lack of appetite, and the pain. Now, 1 in 7 people living with HIV unaware that they have it. And the World Health Organization put out some numbers that is over 500,000 Americans have died so far from HIV and AIDS, and over 1 million are still living with the disease. And most every state that has medical cannabis has HIV as a qualifying condition. And they use it, with the antiviral therapy. And again, a lot of those therapies cause nausea, vomiting, weight loss, and nerve inflammation too. So the CBD as well as the THC products help cool down some of those symptoms and side effects that you get from that. Wasting away is a big role in HIV and AIDS, and the stimulation of appetite with THC products has been very beneficial. And there's just more chemotherapy stuff for AIDS. These are all different studies. And again, like with any chronic illness, the products help with mood disturbance too, so depression, anxiety. So you get the reduction in peripheral neuropathy with the HIV patients from the CBD, and this is why it's been very beneficial for them, all these different studies, that it's reduced pain and improves mood and depression. Nausea is the biggest thing, especially with a lot of the antiviral therapy. Usually HIV patients are on 3 medications they call triple antiviral therapy. Crohn's disease is another condition that it's approved for in the state of Florida. It's another incurable disease, not as bad as some of the neurologic disorders, but patients have fever, chronic diarrhea. They can have bad arthritis pains too with any of the GI inflammatory bowel diseases. So Crohn's, ulcerative colitis, those people will also have bad arthritis too. So the Crohn's disease, what it does is cause inflammation throughout the digestive tract from the mouth all the way to the bottom. You can have it spread out anywhere. And it'll cause bleeding, inflammation, spasm, pain. You can get abscesses and infections, needing surgery and partial removal of your colon from it. So with the CBD products as well as sativa have been very helpful to Crohn's patients, because what they do is they cool down that inflammation, and so patients are having less flare-ups, less infections, less abdominal pain. So an estimated 700,000 Americans suffer from Crohn's disease. So this is why it's been approved. Cannabis alleviates symptoms of Crohn's disease. This is a 2005 study. And what they basically did was they had these patients take cannabis, and then they had them evaluated on their symptoms: nausea, pain, vomiting, fatigue, and activity levels. And almost all of the patients had a very positive response to medical cannabis. In 2011, this is an Israeli study that they did, and they evaluated these patients with the same kind of questionnaire and stuff like that, and showed that the patients had significant improvement in the decreased disease activity, as well as a reduction in their symptoms. Glaucoma is another disease process which you can use it for. Glaucoma is basically a problem with plumbing through the eye. There's little tube systems through the eye that drain fluid from one chamber, the anterior chamber of the eye, to the posterior chamber. And when that inflammation causes obstruction of those ducts, the pressure in the eye goes up, the outlet's blocked, and the pressure on the eye damages the nerve as well as all the structures inside of the eye that help it focus. And so what ends up happening is you go blind. The glaucoma is the second leading cause of blindness in the world today. So what the THC and the CBD products do is they decrease the inflammation around these tubules and open them up so that the fluid is draining very well between the front part of the eye and the back part of the eye. And it reduces the ocular pressure, reduces the damage to the eye, as well as the optic nerve. It also helps with pain and the nausea and vomiting that comes with having high eye pressures and glaucoma. Seizures. Recently, I think within the last 6 months, there's a drug came out. It treats seizures in kids, and it's CBD. It's manufactured CBD is what they're using for the drug. So it's been shown the THC products as well as the CBD help cool down the brain activity. So what ends up happening is you have all these spikes in the brain, and when they're conducted, they cause seizure activity, whether it's arms, legs, or just a global seizure. So during epileptic seizure, the rate can increase up to 500 times a second, the conduction through these neurons. So the CBD and the THC products help cool that down, and it lowers the seizure threshold in these children. And there's a slide here that talks about Charlotte here. Charlotte is the one that they named Charlotte's Web after, which is a high product you can get that has CBD and I believe sativa in it, and it was used successfully controlling her seizures. So they named it Charlotte's Web after her. ALS, it's another neurologic disease. It's basically the nerves are being damaged again, and they don't conduct impulses well throughout the body. So the brain tells it to move, and the lower body part doesn't move. And it's damage to the nerve fibers throughout the system, basically the wiring of the body. And so what the CBD and the THC products do, again, like they do in MS, they cool down the inflammation of these nerves and the synaptic joints. It's not a cure, but what it does is it stops the steady progression of it. And people with ALS, unfortunately, 100% all die. There's no cure for the disease. But if you could slow down the progression so people can last longer and treat their symptoms, it helps. And that's why it was approved from these studies that were done out in California. One study showed it extended some person's life by up to 3 years. You know, and it's a painful disease to have because you get these uncontrolled muscle spasms, and the CBD as well as the sativa helps with it. All depressing. You got to just go through the slides. This is all these different diseases. Chronic pain, you know, it's been shown to help chronic pain. That's why it has the approval for it, because of the inflammation. So arthritis, osteoarthritis, rheumatoid arthritis, we can qualify people for that based on the chronic pain. And that's why you have people smoking it for years, because it helps. So other qualifying conditions, so basically pain, anxiety, insomnia, GI disorders like ulcerative colitis are a qualifying condition because it's similar. Rheumatoid arthritis, psoriatic arthritis. I have patients that have migraine headaches that are using cannabis.
Do you see good results with that?
Yes, oh yeah, great results. They love the pens because as quick as they can see, you know, the aura or the strange smell that comes with a migraine headache, they hit the pen and they cool it down. Any kind of spastic disorders. I had a young lady in my office today. She had cerebral palsy with spasticity, and so she wanted to try medical cannabis. Tourette's. I have a couple of Tourette's patients too that have done very well. So how do you get started? Let's talk about that. The first thing you do is find a doctor that does cannabis. Okay, and then you got to go visit the physician. The physician conducts an exam, goes over your medical records, then they'll certify you if you have a qualifying condition. They'll put your name in the database for the state, and the state will send you an email, and in that email will be a link, and you click on the link, and the link will take you to that page. You establish a username and password in the database. You verify everything in the system the doctor put in is correct. Then you pay for your card. Once your card payment clears their clearinghouse, which is usually 5 or 7 days, you're activated by the state, which means you can start using the medical cannabis. You can use your ID number as well as your license, and you can start getting the medical cannabis. And what's Curaleaf's policy on that? Will they do a home delivery with someone who just has the license and
Or the email. Mhm.
Or the email.
Or you can come in with the email, or you can come in before you even get your license. You can come in and talk to us and get educated and just see what you might want to, you know, get a consult basically.
You download a headshot of yourself. Most people use their license. They'll take a picture of the license and they'll crop the headshot. You send it into them, and then 3 or 4 weeks later you get a card that looks like that with your picture on it. But once you get activated, you can go to the dispensary and start using the medication. You have to follow up with a physician every 6 months. They have to recertify you and verify with the state that you are doing well on the cannabis and haven't had any problems. And I think that's it. April 1st, we're opening up our second clinic down the road here on Van Dyke. So we have one location out towards Wesley Chapel and one here. Does anyone have any questions?
The $75 fee, is that every 6 months as well?
No, it lasts for the year. So like 45 days before your card runs out, you have to go back on and pay another $75 for the following year.
That's to the state.
To the state, yes. To the state. Now, when you're starting, what I recommend, especially if you're like brand new to cannabis, only get like a 3-week supply. Some people go out and buy like 70-day supply, and then they find out that, well, this form is not working for me. Okay? I like to use the pens because they work fast. But I like to use the oral solutions because they're easy. You know, Florida doesn't have approved edibles, so what I have patients doing, do you have the bags?
What's that?
I have patients making their own edibles. You take an Oreo cookie, you pop the top off of it, you put the oral solution on it, take the cookie, you wash it down with water, you just made your own edible. It's clean, and that's it. And like I was speaking about earlier, before a lot of people walked in, do you want to hand the rest of us out? is that if you just use the pen, you'll chew through the pens, and you'll go up and down and up and down and up and down. And I'm gonna put that slide back up because I think it's very
Yeah, you made
important.
an interesting point when you said about eating a cookie at night because it gets in your blood sugar because it spikes it, so it hits it kind of to juice it out. But
Yeah, so
what
like-
if you want to do an edible in the morning time and rather than put on Oreos all the time? What else is something easy?
Anything fatty.
So definitely always put on something fatty.
It's got to be something fatty.
Okay.
That's why they make marijuana brownies, because the fat